for many reasons, often combined with infectious diseases. And even the department is called Infectious Medicine and Tropical Diseases. So this is meant to be the first lecture on these topics. Why are we interested in tropical diseases? For many reasons. Actually, when we refer to tropical diseases, we mean certain tropical countries or certain countries who have tropical environment, that is a specific rainfall, certain environment which will invite vectors, what we call insecticides, usually insects, which transmit diseases from one area to the other because the environment is favorable, and then a disease is there. So it's a combination of an environment, and then these diseases will certainly lead to other unwelcomed sequelae like poverty, and poverty will lead to more deterioration of health, poor sanitation, lack of drinkable water supply, and then flies, and then the vicious circle starts, which continues with more disease and more harm to the population. The tropical diseases are becoming very important for many reasons. Not only that, it gives morbidity and mortality to a large population in the world. But also now we are talking about migrant tropical disease or migrant medicine, where we see tropical diseases in Western countries, Southern Europe and USA and Canada. And this is often called either migrant medicine or emerging medicine in these areas. And it is sometimes called the blue marble health, blue marble health. That is to say we are seeing tropical disease in certain Western countries who have no environment for transmission of tropical disease. But certain diseases are being transmitted. We can remember that malaria was prevalent in England for some time, despite the cold weather, but now it's been terminated or been eliminated. So if we look into the global health map, we will see that these diseases, tropical diseases and infectious diseases, will rate very high as far as mortality of individuals and morbidity. It's just enough to say that malaria claims 450,000 individuals every year. And if we put the classic tropical diseases like schistosomiasis, onchocerciasis, filariasis, guinea worm, hydatid disease, cysticercosis, if we group them together, then this claims another 750,000 of the population, mainly from tropical countries. So it's a disease which is still ranks very high in the morbidity scale of other diseases, more than maybe a lot of other diseases which are receiving a lot of care than the tropical diseases. Secondly, the world is now a small village, and after the COVID-19, the coronavirus pandemic, we have even appreciated that it is even smaller than what we thought is. Suffice to say that a brand or a subtype of the coronavirus reported in South Africa will appear in Canada in less than 36 hours. So it's just a small world. And even the Western world has appreciated that it has to care about the health of the whole world because they will be affected one way or another. And it's not only limited to the tropical countries. Secondly, we can talk about three diseases which are receiving a lot of aid. These are malaria, uh, tuberculosis, and HIV/AIDS. And these diseases, the three of them, are receiving quite substantial help from what we call Global Fund. And this is a fund which many countries contribute to and distributes mainly drugs to low-income countries for free. So even in Sudan, we are receiving anti-tuberculosis drugs free, anti-malarial drugs free, and certainly antiretroviral drugs again free. And you remember HIV/AIDS is now a chronic disease. If you take the antiretroviral therapy, then people will prolong the life and the transmission of infection will be less. So this is the three diseases which are receiving a lot of help from the Global Fund. And then we group another, what we call classical tropical diseases, which is, as I mentioned earlier, onchocerciasis, schistosomiasis, and the rest of them, are now grouped into one single group to attract attention to them, and they are called neglected tropical disease, NTD. And this is coined about maybe 15, 20 years ago when these diseases have been completely neglected by the donors and by the rich countries. But since that call, I think, in my view, that these diseases has received a lot of attention, calling being neglected tropical disease. But I think many who are working in the field of tropical medicine and the non-neglect and the classic tropical diseases are enjoying the term neglected tropical disease because it attracts more attention. And in the last 15 years or maybe 20 years, the world has given attention to these neglected tropical diseases as far as control is concerned, as far as treatment is concerned, as far as medicine and remedies as are concerned. So the WHO has lined up about 20 of these diseases, which are coined for control as public health problem or and elimination. We are not talking about eradication as yet, but we're talking about elimination possibility. In the last 20 years, we have witnessed the fact that some of these drugs have been eliminated from certain foci or certain countries in Africa. Example being onchocerciasis after the distribution of ivermectin, which is the drug of choice for 15 years in certain countries, coupled by insecticide. The disease has been eliminated in certain areas of Africa. So the elimination of these diseases is possible. Is possible. This is why we think the attention which is being given to these diseases really paid dividends because more money is now being poured in the control of neglected tropical diseases. So as far as tropical disease is concerned, apart from the malaria one, apart from the infectious tuberculosis, the rest of the diseases mainly cause disability or morbidity. And this is measured by DALYs, which is disability adjusted life years, DALYs. And these drugs put together, they give a lot of millions of years of retarded activity, and they usually point to the fact that this is the disability adjusted life years, meaning that their life and their years are not as productive as it should be if health has been provided. So, uh, this is a vicious circle, of vicious meaning malignant in a way, or sinister, or not acceptable. If we start with the disease and then we end with the disease, you can join me with the circle. The diseases of tropical medicine will cause mortality, like malaria, but more so will cause morbidity, which is disability adjusted time or life. So this will definitely lead to less workforce in these countries, then maybe complete disability, and patients will be unable to walk. If you have a big leg of filariasis, lymphatic filariasis, you cannot move, you cannot do your work, and then you are bedridden, although you are not dead, but you are not productive. And this goes on for the severe itching, which occurs with onchocerciasis, and blindness, which can occur with onchocerciasis and trachoma, leading to people, blind people in young age. These are the working force of these countries, and if many of them are around, the workforce will be less. As far as children is concerned, when they are affected by these diseases, or when they have intestinal worms, which is another targeted neglect, the children will not go to school. They will perform less. They have less cognitive abilities. So they do badly in the schools and they lose education. And both these, workforce being less, chronic disease will lead to inability to work, less cognitive function for children, then definitely this will lead to poverty. So the circle goes from disease to morbidity and mortality, and then less workforce, less ability to work, poor education, then this will lead to poverty. And poverty is is an important factor in these tropical countries, whereby we can see the cumulative effect of tropical diseases. So poverty will definitely lead to malnutrition in children, less performance. It leads to less work, and more important, poverty will lead to a bad environment, sanitation will be poor. We cannot have better sanitation, so flies and other insects will grow. They will have malnutrition, because poverty will lead to malnutrition. Malnutrition makes these people very susceptible to disease, and more disease will come and eat them out. So this is a vicious circle. It starts with the disease, leading to mortality and morbidity, then leading to less workforce, less abilities, poor education, and then the other circle goes into poverty, and poverty is an essential factor in when we talk about tropical diseases. Poverty is always an important index, and then gives malnutrition, and malnutrition will give diseases. And obviously, if your immune system is down, then you will have more diseases. So the neglected tropical diseases and other infectious diseases are important. Are important. But despite the fact that they are important, there is poor knowledge about these diseases. So it's important that we highlight in the University of Medical Science and Technology being an excellent university, we have to cover this. And it's not only to cover this for students in the endemic countries, but even for advanced Western countries. Because now there is an influx of people going to Europe and going to the States. As you know, the illegal trafficking of people across the Mediterranean to South Europe, and then they distribute themselves in whole of Europe. Then they bring diseases with them. Okay, so it's important that these are going to be part of the population of the Western world, and they may harbor diseases which may have transmission or may not have transmission, but they need treatment. So, and certain diseases are still prevalent in southern Europe, like visceral leishmaniasis, maybe dermal leishmaniasis, and maybe intestinal worms. So it's important that if you are doing medicine in Europe, then you know about this. Uh, so the that is what we call the migrant medicine. But one thing which we have to bear in mind is that you can contract diseases if you come to Europe, to Africa, for as tourism or business, and then when you go back to Europe, you may catch one of these diseases. Okay, so it's important that you will have the differential diagnosis of these diseases in mind when you are practicing in the Western countries. So, uh, back to the incubation period, if you leave, say, from Zanzibar to UK, you may be very fit when you landed in Heathrow airport. Then in 10 days or 15 days, you develop fever, which tend to be malaria. And this is likable to be malaria because the incubation period. So you may get disease not on arriving in the country, but days, and this causes confusion. The second point is when you go into a tropical country from Western world, you may contract disease, but not immediately because you need some incubation period. So remember, the incubation period of a disease may give you confusion in diagnosis. In this respect, we have to talk about emerging tropical disease, emerging tropical diseases. And we have been talking about emerging infections. The coronavirus, pandemic of coronavirus is an emerging disease. The virus is a zoonotic because it harbors itself in bats, but it has been there for quite a time. Then it flared up in China and it spread all over the world. And there is many lessons that can be learned from the pandemic of the coronavirus. Not only in deaths, morbidities, and the expenditure of health, but also the economic impact of the pandemic having retarded the economy of even big countries like USA and Europe, Canada, and Australia. So these diseases have their impact not only limited to where it emerged, but it can spread to other countries where it can see the toll of life losses, toll on economy, and toll on social bonds because this is what happened in the corona. So we are talking about emerging tropical disease. And I have in mind two diseases, the Zika virus, and I hope we will touch on that. And then the Plasmodium knowledge. Knowledge is plasmodium, it's type of malaria, which is also emerging as a tropical disease. So for the spread of the disease in endemic countries, leading to morbidity and mortality, because of the immigration of diseases to Europe. The transmission is possible, and the emerging tropical disease. The whole world should really work hard to control these diseases at their origin, which is the tropical countries. Uh, Having said that, I think it's important to mention that there is very good progress in treating tropical diseases. We live, in the world where there are no drugs for many of these tropical diseases. We used to have suramine for onchocerciasis. Is a macrofloricidal. Macro meaning big, floricidal meaning it kills the adult worm, and then microfloricidal meaning small or baby worms. These are in progress to adult worms, and there are drugs which will deal with the adult worm, and there are drugs which will deal with the small worm or the developing worm or the baby worm. So macrofloricidal, remember these terms which are going to be important when we talk about drugs, and then microfloricidal. I just want to say that we used to have very toxic drugs. Suramine was toxic, it's an amazing drug. It can't kill the adult worm, but it nearly kills the host as well, causing renal disease, skin disease, and a lot of other problems. So these are in the 70s, in the 70s, early 80s, we didn't have enough drugs. I remember when we used to go to South Sudan, in Raja area, where it's very endemic with onchocerciasis, in Wow, river in Wow, where onchocerciasis is very high. We used to go and do research, seeing patients, collecting data, skin snips, examining eyes. And at the end of the trip, people will come to us, where is the drug? Where is the drug? And at the time, we didn't have any decent drugs which we can give to them, offer them. And we used to shy away for not giving the drugs, only antihistamines, which is hardly do any benefits. So, but lately, in the 90s and early 20s, we had very important drugs. And this is great the great advances in tropical diseases. Mainly in the pharmaceutical area, pharmaceutical arena, that we have very important drugs, uh, uh, which is not only very effective, but improves morbidity and lessen mortality, okay, and make patients better as far as working is concerned, as far as social bonds are concerned. So these drugs are the hallmark of progress of tropical diseases. And I think it made studying, working in tropical diseases very, very interesting, because now you have abilities to control these diseases. I mean, days gone, we just diagnose and then we look at the patient, unfortunately, and we can't help. But now it is very important that we can help, we can get the drugs, and the importance of these drugs they are very safe. I will mention 4 or 5 drugs, which if you learn these 5 drugs, then you learn almost all what you should learn about drugs for tropical diseases. So they are safe, and this is extremely important because we used to have very toxic drugs which kills the patient before it kills the worm. So number one, it is safe, and I would like to stress this, because not only safe given by a nurse, but even safe to be given by a volunteer in the village. And this has made it possible for distribution of drugs in what we call mass chemotherapy. You have an individual chemotherapy and you have mass chemotherapy. And mass chemotherapy is being given to patients in endemic areas who are at risk, maybe not diseased at the time, but they are at risk of getting the disease. So mass chemotherapy can be distributed, and this is very expensive to distribute drugs to a population, a community. So if it is safe, if it is can be handled by volunteers from the village, then all you will do as a health system is to bring the bottles of the drug and teach the volunteers to distribute the drugs in a mass fashion. And this has been very effective. I worked in the African program for oncocercitis control for more than 17 years, and the what we call CDI, community directed intervention or community directed distribution of drugs, CDT, community directed CDT, community directed distribution of drugs by volunteers. Okay, or CDD is the community distributor of drugs, CDD. So these are being trained, and every year we deliver the drug to the village, and then it gets distributed. By the time we have an intervention here. Can we continue? Can we continue? Are you with me? Hello? Hello?
Yes, Prof. Like.
It's okay? Robert?
Yes.
All right.
Yes.
So this is mass chemotherapy because the drugs are safe. Secondly, it can be given by mouth. And I think this is again something which makes it amenable to mass distribution. Because if you are giving injection need to be given by a paramedic or a medic. It's very costly because you need a syringe, you need precautions of HIV/AIDS and hepatitis, and the rest of it. So being given orally is another great advantage. And thirdly, because of the call at the time of neglected tropical diseases, the call and the stir which has been made by scientists and people of concern of the tropical diseases, the drugs are being given free of charge, mainly donated by the drug companies. Merck, which has led this campaign, have donated mectizan, ivermectin for free for all those who need it for as long as it is needed. So ivermectin, and this is a commitment. It's not a commitment of 1 year, 2 years, 3 years. It's a commitment for many years to come. And now they are distributing these drugs for free for almost 20 years, okay, to all those who need it. And this is a big undertaking and a very charitable action, which deserve to be praised for. So these drugs are orally given. They can be given orally, easily, with very minimal side effects. They can be given by volunteers, and they are free. This is important because we already talked about poverty in endemic countries, and so poverty meaning that they cannot very important. Okay, we'll talk about the drugs. If you are stimulated to hear about some of the drugs, I will give it to you. If you know 5 of them, I would reckon that you can treat at least 10 of the endemic diseases. So the first one is ivermectin, I-V-E-R, ivermectin, M-E-C-T-I-N, ivermectin, and the commercial name is mectizan. Mectizan. And usually we don't favor commercial names or brand names. But this drug, this company, because the drug is given free. So what is the point? What is the fuss? There is no fuss about giving it brand names because at any rate it's given free. So there is no commercial competition here. So it's Mectizan, which is ivermectin, and ivermectin is mainly given for onchocerciasis, almost like the only drug which can be given for onchocerciasis. And it is a microfilaricidal, meaning that the adult worm will not be affected. So, and the adult worm lives for 15 years. So, if I continue giving the drugs for 14, 15 years, then the adult worm will die out and the patient will be treated. And this happened. This happened over the years now in Senegal, Mali. There are areas where is completely cured, completely eliminated of onchocerciasis. So drug number one is ivermectin. And ivermectin also is a drug of choice for lymphatic filariasis. Lymphatic filariasis caused by filaria is a filarial drug, which Washarira, what we call Washarira bancrofti, which lead to elephantiasis or hydrocele. Okay, so the ivermectin also works for elephantiasis or filarial worms, but given with another drug called albendazole, endazole, DAZOLE, albendazole. And the drug is mainly the drug of choice for intestinal worms. All intestinal worms, apart from Tinea saginata, and Tinea solium, and Hymenolopis nana, they can respond to ivermectin. So ivermectin in combination with mectizan or ivermectin with albendazole, then it can be given to filariasis or elephantiasis or Washarira bancrofti. So we have two drugs now. The ivermectin for onchocerciasis, ivermectin also for lymphatic filariasis, and ivermectin has a partial effect on intestinal worms. So the offshoot of giving ivermectin in mass chemotherapy to ivermectin to onchocerciasis, then also it treats intestinal worms in some way or another. So there is extra benefits. The third drug is praziquantel. Praziquantel is drug of choice for schistosomiasis. And for all types of schistosomiasis, praziquantel is the drug of choice. For Mansoni, which is intestinal schistosomiasis, for hematobium, which is genitourinary schistosomiasis, and the Japonicum, again, Japonicum is mainly in Southeast Asia, Japonicum. It's a schistosomiasis. So praziquantel acts as a drug of choice for schistosomiasis. Also, praziquantel is effective against Tinea saginata in a smaller dose. If we talk about a dose of 40 milligrams per kilogram body weight for schistosomiasis, it works at the dose of 15 milligrams per kilogram body weight for Tinea saginata, الدودة الشريطية. And although it's an intestinal disease, Tinea saginata, but its sister, which is Tinea solium, that occurs in the pig, it causes cysticercosis, which is cysts, maybe in the liver, in the brain, and it's the main cause of epilepsy in South America. So that is a nasty worm which can give systematic disease. So ivermectin for onchocerciasis, ivermectin for lymphatic filariasis, and partially ivermectin helps clearing intestinal worms. Albendazole is mainly for intestinal worms, round worms like Ascaris and Clistoma duodenale, and strongyloides. These are for albendazole. And albendazole in combination with ivermectin can be given to lymphatic filariasis. Okay, so we have the three drugs, and then the other drugs which are partially not partially effective but not safe may be given by IV. So if we have these three drugs, prazoquantil, ivermectin, and albendazole, these three drugs can treat schistosomiasis, can treat intestinal worms, can treat tinea saginata, lymphatic filariasis, tinea solium, and also Hydathy form, okay, Echinococcus granulosus, which causes Hydathy disease. And Hydathy disease it appears in cysts. The disease, Echinococcus granulosus, which is a worm uh, transmitted by dogs. They can be swallowed, and the larval stage will grow into cysts in the liver